Well, the answer in terms of are they regulated is easy. Yes. With that said, it's urban mythology that the industry is not regulated, and I personally find it very frustrating because I think it leads the public to think that they're at risk or that the government and the industry doesn't really care about what's happening. The reality is that any company making supplements has a responsibility to ensure they're safe before they're even released upon the marketplace. Once they're released upon the marketplace, there's what's known as post-surveillance. Any indication that there's a problem, information is collected, it's immediately transferred to the FDA, careful records are kept, and it's like having the finger constantly on the pulse to say, is there by any chance something that wasn't perfect? So it's very highly regulated in that regard. Advocare takes this serious as a leader in saying we want to have adverse event reports. And you always will be told that if you hear something, you want to know about it, look into it and inspect it. So levels of regulation are in place and are fundamentally the same for the FDA as you see for any other sort of food product out there. One of the consequences of this is Advocare goes out of its way to only get those sorts of compounds and constituents of the supplements and food products that meet the highest criteria. They're not just efficacious, but they're very safe.
And I think there's so much more. Not only are those FDA regulations about good manufacturing practices and adverse event reporting, but the quality assurance that we see at Advocare in the sourcing, in the testing of the purity and the quality of those ingredients, the efforts of quality control and quality assurance are really robust at Advocare. You can be guaranteed that what is on the label is exactly what is in the product. I mean, that's a really important aspect, not only to safety, but to efficacy. When Advocare combines ingredients, not only are they all pure, but they're designed to work together to be really efficacious. To make sure that that's true, Advocare uses independent third-party reviews for certification and guarantees that this is the case. So there are quality assurance programs both within the company, and Advocare uses outside independent reviewers that test each of those ingredients to say that they are what they are before they even go into that manufacturing practice, and then the final product is tested again.
Yeah, it's worth noting that the term that you're going to hear sometimes is GMP, which stands for Good Manufacturing Practices. This is a very rigidly defined set of criteria that companies are supposed to follow. And I'm proud to say that Advocare follows it diligently and then does even more on top of that.
Right. And I would just add there's one other regulation that wasn't mentioned in addition to the Food and Drug Administration. The FTC, the Federal Trade Commission, also regulates what the label looks like, what you can say about the product. That's another regulation that Advocare adheres to closely.
I think it's worth noting that that's one of the reasons that we always are very careful to make it clear that these are products for healthy individuals to help try to maintain you as healthy individuals. They're not developed to actually treat specific diseases, hopefully though to prevent disease.
Okay, let's switch just a little bit gear and talk about particular products, or actually a group of products. Let's talk about the 24-day challenge. We have so many new people joining Advocare every day. They are very keen to start the 24-day challenge. And the question is 24-day challenge actually for everyone? And what about the people with certain dietary restrictions? Dr. Pimienta and Dr. Cresci, would you help us with this?
Well, that's true. I mean, the 24-day challenge has been successful for thousands of people, which is fantastic. But it isn't necessarily appropriate for everybody. And that's where we really recommend that each individual person consult with their physician first prior to embarking upon the 24-day challenge. So if the 24-day challenge may seem a little bit daunting to someone because it's so many products to take all at once when they're not used to taking any products at all, or if there's a certain component of the 24-day challenge that may not be appropriate for them, one approach is that fortunately each individual component of the 24-day challenge is available individually. And what I would suggest is to perhaps start with the probiotic product and the fiber. And that's a great way to get started because I would have to say most people could benefit from improving their intestinal health. And the probiotic and fiber product are a great way to start in getting that system going and getting your intestine health on track. After that, products can be added sequentially. They could add perhaps the Catalyst product, and then the Omega Plus, and then maybe then add on one of the MNS systems after that.
So the other thing to remember is that for people that have issues taking thermogenic products, then we have the core that is available to use as a supplement. And again, it is to make very clear that most people in this country will benefit from taking some sort of fiber. We are not taking enough fiber. We are not taking enough fiber in our diets. So that is something safe for most of us as well as the probiotics. In regards to some of the specific dietary requirements to be called gluten-free or to be called halal or kosher, agricultural products are really not produced on places that adhere to those specific requirements. So you cannot say that Advocare is gluten-free or that is specifically halal or kosher. So although the products can be safely used and can be adequate for many nutritional replenishments, they are not considered gluten-free or halal or kosher.
There are some nice components, though, of the Advocare products that you may not think about. So for people who have glucose control issues, a lot of the products are sugar-free. And so that's a fantastic supplement that tastes really, really good, that can be very helpful for a lot of people. They're also very high in protein, many of them, and a very good digestible source of protein. And that can also be very helpful for people who are just not interested or not able to consume enough protein in their diet. I also actually had a couple patients ask me about the meal replacement shakes, and there's a patient population that many of you may be working with because they're dealing with weight reduction, and those are individuals that may have had weight loss surgery. And these patients have to follow a sugar-free diet after their surgery. And this is a very nice companion system to their diet. So it's a nice addition for them.
But
I think
I would also say that a proportion of patients are not necessarily a proportion of people are not necessarily the people that require to control their calories. But we have a good proportion of especially elderly that are not getting enough calories in and not getting enough protein in. So having a meal replacement shake sometimes is a good way to supplement them. And if you compare to what is in the market, if you compare to the really high sugary products that there are out there, that most of the people I deal with really don't like the taste, then it's a good alternative for them.
I think a very important take-home message from this is if you have anyone who have underlying medical conditions, so if you have questions if this might be suitable for them due to different reasons, their primary contact person should be their physician to ask these questions.
Now, the next question is something that comes up all the time, and it was actually touched on during the last question. That's the use of sugar or non-caloric, non-nutritive sweeteners. So, Dr. Redmond, Dr. Dudrick, why are non-nutritive sweeteners used in Advocare products, and specifically sucralose? Why does Advocare use sucralose?
Well, Dr. Hartman, thank you for handballing that to me. One, because I actually get a little bit tired of this question, why we use non-nutritive sweeteners, and I actually think the question should be, why don't we use sugar? So I want everyone to get their pens and paper out because I know you guys like some facts, and I'm going to give you a few facts about sugar. So the United States, the group that regulates or helps us to determine our dietary requirements, tells us that men should have about 9 teaspoons of sugar a day, and for women, that's about 6 teaspoons of sugar a day. So in 1 year, the average American adult eats 100 pounds of table sugar. And if we break that down, that's about 30 tablespoons of sugar a day, or 1,400 calories worth of sugars. So the question should be, why don't we want to include sugar? If you remember back to the old school, the food pyramid, right? It looked like this, and we had fruits and vegetables at the bottom, and then proteins. Right at the top was fats and sugars. And there's a reason for that, and it's because we know that sugar has many ill-toward effects on our health. So Advocare would not be a health and wellness company if we contributed to all of these hidden sugars in our products. So we're trying to combine the best nutrition and the best quality ingredients, which for many products come from plants. And quite honestly, we wouldn't be able to consume and enjoy these products if we didn't add a sweetener, because it would taste like dirt. So we want to bring sweetness, we want to make the foods palatable, but we don't want to add toward the ill effects, as I said, to health by adding sugar. So that's why we add a non-nutrient sweetener. We have chosen sucralose because it is the most like table sugar in terms of its formation. It's not metabolized by the body, so it doesn't contribute to raising blood sugar levels and things like that.
Well, as Leanne has said, we are a society that's hooked on sweetness, and we're different, for example, than the Japanese, who don't tend to have things as sweet as we do, but then they have things that are a little more bitter. So taste is something that's difficult to legislate, it's difficult to argue about. A lot of opinions on it, and opinion is what governs the attitude toward sucralose. As Leanne said, it's not metabolizable. You take sucrose and add 3 chloride ions to it where there formerly were hydrogens, and that's the change in sucrose from sucrose. And the people that are against this or against that give these arguments that really don't make any sense. They say they want natural sweeteners like sugar. Well, sugar is all refined, either from cane or beets, so it's also processed. And opinion or prejudice is probably the major driving force for what people think about sucralose. I tell our students sometimes that there's more medicine practiced by prejudice than by data. And the same thing happens out in the public with its attitude towards sweeteners, and especially sucralose. It has more than a 20-year history of safe and effective use. There's never been any adverse effect from sucralose that threatened anybody's life or limb or health. There's no warning from the FDA required on the packaging. And we have more than 200 research artifacts in the literature attesting to the safety of sucralose. So what's the problem? And there really is none, but we have to make one up to talk about it. And sucralose is safe.
And for Dr. Dunker, for a physician and a surgeon who has built his career and reputation off saving lives, off improving the health and wellness of everybody, to take the stand and say sucralose is safe and effective, that's good enough for me. I know it's good enough for you, and I think we all support that.
And it's definitely good enough for me. So here's a question which we very often hear from our healthcare professionals. We have more and more healthcare professionals getting interested in Advocare products, and of course they want to have more knowledge about them. So the question is, if someone is taking the medications to treat some underlying medical conditions, do we know any interactions between Advocare products and these medications? And the other question is, why do some of the Advocare